Hello, I'm Dr. Brant Gibson, and today I want to talk to you about another way that we can actually test nerves. And this is actually can be pretty specific on what information it's giving you, and it is probably one of the most commonly used tests for peripheral neuropathy. This is the nerve conduction velocity test. The nerve conduction velocity test is basically a test to determine the speed at which a nerve is functioning, whether the nerve is functioning like it's supposed to. And with this, there's a second test that sometimes is done separate or done with it called the electromyograph or the electromyographic study. And we're going to talk about both of those and what they tell you about your peripheral neuropathy and why they should be done. Number one, the nerve conduction velocity test is a test that is either done with needles or with pads, where it actually has a needle or a pad on two parts of the nerve, to determine the speed at which the nerve is functioning. And you're actually testing, you're sending an electrical signal, seeing how it flows through the nerve and how it flows to and from the spinal cord and so forth, to determine if the nerves are functioning like they're supposed to. And basically it gives you a good amount of information, and you can say, okay, yeah, this nerve is not functioning like it's supposed to, or this nerve is functioning like it's supposed to. And it's a good indicator of primarily peripheral neuropathy of the large sensory nerves. It can also show some of the peripheral neuropathy in the large nerves that make up the motor nerves. So it can actually show you a motor neuropathy as well. The electromyograph is even more specific for motor neuropathy because it actually tests the functioning of the muscles and sees if there's any weakening or changes in those functions that can also indicate motor neuropathy. Now, the one thing I want to make sure that you understand with the nerve conduction velocity test, you cannot rule out peripheral neuropathy just by taking a nerve conduction velocity test. Although this is done on a regular basis, they do, oh, we did this test, you don't have peripheral neuropathy. That's not true, because you can have a small fiber peripheral neuropathy, you can have some forms of motor neuropathy, and you can have an autonomic neuropathy and still have a nerve conduction velocity test that is normal. So nerve conduction velocity testing is very good at determining large fiber sensory neuropathy. Electromyograph is very good at determining a motor neuropathy, but it does not rule out small fiber sensory neuropathy or autonomic neuropathy. This is Dr. Brant Gibson, and this is your neuropathy nugget day 252, nerve conduction velocity and electromyography in determining if you have peripheral neuropathy. And this is a test that should be done, a test that can be done after periods of treating as well, because you can see some improvement and ultimately may even document that the nerves are functioning like they're supposed to. It's Dr. Brant Gibson. Have a great rest of your day.